People have come and gone, administrators, new generations come and go, yet there's a history here, certainly a respect for volunteerism, but an incredible respect for the Ladies Visiting Committee.
Volunteers are hard to come by today. Everybody works. It's a statement that so many people come and volunteer at this hospital.
The principal reason that people become an LVC member is because they have shown total commitment to volunteerism here. Even if we don't know each other, if we see this on somebody, we're very happy to make ourselves known to each other. Yes, it's a big part.
Most hospitals had you delivering flowers or being nice to people, which is wonderful. But this was suddenly an experience of actually doing something that no one aside from a volunteer could really do. The first patient I went and saw, he started out about how terrible this was and how terrible that was. And I said, this sounds as though it's been a terrible experience for you. And he said, wait just a minute. I wouldn't be alive if it weren't for this hospital. By the time I left, I realized what a helpful thing it was for patients to be able to talk to someone who had no vested interest except for kind care in the hospital.
In the initial charter, it says, when in distress, every man becomes our neighbor. And we linked into that and said, well, as crazy and busy and complicated and layered as this organization is going to get, how are we going to make this a neighborhood, a comfortable environment? How are we going to soften some of those edges?
We spend about over $30,000 a year on flowers around the hospital, which we feel really makes it a softer, friendlier, more welcoming environment.
Head of social service, head of nursing, was to establish a group of volunteers, Ladies Visiting Committee and others that could help discharge patients so that when the patients left the hospital, they felt good about the hospital and good about themselves. And that was quite an accomplishment.
Then there was Jane Clafton suggesting that people who were on dialysis needed somebody to read to them. So she started the program of reading to patients who were on dialysis.
Even before it became the Children's Hospital, there was always a pediatric department. And we did any number of things for them. Crayons, books, educational books.
There was a time when Dr. Warshaw and Dr. Azekowitz, they wanted a general pictorial way of connecting all these little departments, you know, the emergency room, the rooms on the floors. So they had an artist that they want to have involved, and quite gifted, and came in and did a lot of artwork so that when the child entered, they saw fish and dolphins and underwater stuff.
I think one of the finest things that we continue to contribute to is Women's Health Fair. And it's held every year, and it is designed to bring that population into a fair type atmosphere where they will learn how to access healthcare. And a lot of them are new to the country. They don't know how to access healthcare.
Repeatedly, social service would find a situation either with a patient or a member of their staff where money was needed. And so the LVC gave for several years a discretionary fund to the chief of social service.
As small as things for a taxi cab to send somebody home who had nobody to pick them up. Helping an elderly gentleman for a couple of weeks who needs to have food taken to him at home.
That was, and I think it still is, the way the LVC is seen by the hospital, as a resource and a trusted one.
The LVC, they relish the idea of seizing on a good idea, helping it grow and come to life in some form. And nothing pleases them more than to see the hospital embrace it in some way and move it forward in a more formalized way.
The translator books, Jean Swaim, she started that with one small book in Spanish, and it's gone from that. Now I think we have 18 languages. And from that started the interpretive services.
We are probably at a point now where we are beginning to lead the nation in what we're able to do in providing medical interpreters in all languages at all points in time. We used the wisdom of some of our LVC members to figure out in what clinics or practices might we go first.
We also have given, along the lines of the Social Service Department, to the Haven program.
Which is the domestic abuse.
And that we've given to for a number of years, and we feel very strongly.
And we gave seed money to that to start, as well as the palliative care program.
The chaplaincy began to evolve in part because of the feedback from LVC members talking about patients at these points in their lives at crossroads.
The LVC never moved in like a steam shovel. They really very frequently did a study period for any project that they wanted to do. They would meet with the staff in the area. They would be talking to people. They would give themselves either a year or 6 months or whatever to test out whether this was the idea to go with or not.
We've had a lot of excellent speakers over the years at our meetings. And they're doctors, they're nurses who've gone to Darfur, they're all kinds of different people. It really makes a difference because we can then
Be intelligent.
talk about that with people. It helps us to be advocates for the hospital.
We represent the Mass General when we're out in the public, so we need to be informed, we want to be informed.
When there's an idea or an issue, they are at the table, prepared and willing to put information out front to advance an agenda.
Well, the gift shop, when I first joined and was taking out the store card, was a hole in the wall. There was very little to buy. Candy, that sort of thing, and magazines. And
The shops at that point were run by Connie Thibodeau. Bob Buchanan, who was the head of the hospital, came to us and said, we want to move you. I want you to be on the main floor of Ellison, opposite the Blake elevators and the Ellison elevators, which was, to say the very least, very, very desirable real estate. We incorporated the flower shop at that time. They had to be a gift wrap. It became a huge asset to the hospital, enormous.
And now, of course, it is incredible. I mean, you might as well do all your Christmas shopping right here, I think, from what I see.
And we have a satellite gift shop over in Yorkie. We have a medical shop in the Ellison hallway. Before this great change took place, I think the LVC would sit and worry about whether we could actually spend $500. And now we give back well over $100,000.
In the past, we were sitting there with this money and more money came in from the shops. We've had to try and sell ourselves and let the hospital know we're in a position to fund requests. Now things are turning around a little bit with the economy and so forth. The challenge ahead will be keeping up with the demand.
The hospital is going to probably be here in 140 years, so I think the Ladies Visiting Committee will be here in 140 years.
When I first started, the average stay in the hospital was a week or more. Nowadays, you have people coming and going very quickly. The same thing is true for some of the services we did.
Like the art wagon and the needlepoint, those things automatically phased off because of the length of stay.
And the LVC certainly has adapted and done all sorts of different things since.
Our mission includes not just the patient, but the patient's family and the MGH community at large.
What is needed now is what we address.
We do a superior job, I think, of trying to attend to the needs of each patient, and that's immense when you consider the size and the volume of people that go through here.
The work that we do,
Yeah.
the hospital that we represent, having that in common is our bond. We're different, we're diverse, but we're compatible, and we have the MGH to thank for that.